You're watching NTV Today, and the topic of conversation is child safety. How safe do you consider your child to be in this day and age? And what measures are you taking to secure their safety? The handle is at NTV Kenya. The hashtag is NTV Today. And joining me are three panelists. Right next to me, I introduced you just before we went on the break, but no, it doesn't hurt to do that again. There is Evans Munga from the African, I need to look that one up because it's rather long, African Network for the Protection Against Child Abuse and Neglect. Next to him is Jennifer Kaberi, who is the founder and CEO of Mtoto News. And next to her is Muteru Njama, who is the managing trustee of the Change Trust. Well, you know, in the first part of the program, we aired a story where a mother was willing to sell her 8-year-old baby fresh from Pumwani Maternity Hospital for 50,000 Kenya shillings. And Jennifer, you were saying that's not strange. It doesn't sound strange to you. And why is that?
So, you know, I was watching that. I remember about in 2015, where I live, it's a compound, and we live near Kibera. So a mother came saying, I've been told there's a woman who is buying children. So the guards at the gate, they came, because they know my work with children, they come and told me, Jennifer, this lady who's selling, are you able to help this child? So I asked her, why do you want to sell the child? And she tells me, you know, this child is out of wedlock. I have a husband back at home. I just came to Nairobi to work. And how much are you willing? She was giving me that child at 5,000 shillings. So luckily, I called my contacts at Kilimani Police Station and the Department of Children's Services, and the child was rescued. So that is a normal thing. And you can imagine if that child was taken by a person who is not nice, that child would have gone. Because trafficking, that's how trafficking happens, because this woman has been pushed by poverty. For that particular lady, it was culture, because you're not supposed to go with a foreign child back home. And she was saying, I have 4 other children, 2 of them are sitting exams this year. Where am I going to get school fees? So if you give me that 5,000, I can be able to start a small biashara, and by the time I'm going back home, I have some money that I can be able to feed the other children. So those are some of the things that actually push those women to start selling their babies.
Okay, yeah. Evans, do you empathize, do you sympathize with the situations in which these women find themselves?
Thank you, Olive, and many thanks for inviting us. Sorry for the trouble for the name. You can call
no, it's fine.
You can call it Ancan Region Office, and I'm glad that I'm here to discuss these dissect issues on trafficking. This is a classic case of trafficking, and I'm glad that the media is picking it up, because there are many. This is just one, I mean, in many. The situation of child protection, as it were, is on a dire need, and we need comprehensive community conversations on this, because what I see is lack of awareness from across the divide, both in the civil society activation networks and within the government as well. There's also lack of coordination, because we have so many gaps. You can imagine an institution like Pumwani. Somebody sells a young baby. What are we talking about? So it's time that we discuss these things robustly without even looking at issues and personalizing issues. If you have a job to do, you need to do it. If you don't know how to do it, then somebody has to do it. So we need to have a sober discussion on issues of children, right from government, right to the civil society organization, because we have organizations dealing with children. And this is one case that we need to look into to its logical conclusion. Why did it happen? My colleague Jennifer has talked about factors that pushed this mama to sell this child. Poverty. Are we addressing these issues? Okay. Do we have agencies in government, civil society organizations that can come in to help these issues?
All right, you say poverty, and both you and Jennifer made reference to PUSH. Does it stand for something?
You can go for it.
The PUSH factors?
Yes.
No, the PUSH factor does not stand for it. It's PUSH factor, something that forces you to do something. So some of this, like for example, what you're saying, what are these PUSH factors? What are these reasons that can make a mother want to sell their child? You know, like for example, you said poverty, culture. For example, you want a boy child and you're unable to get a boy child. So you just talk to someone when you see a boy child, pretend to be pregnant for 9 months, and then if you see a boy child, and then you have a child. There's a case, I think, earlier this year or last year, where the child was was stolen, I think it's Kenyatta, and the child was found in Kawangware.
Yes.
And because she wanted a child so bad, her family was pushing her so bad. So she was forced to steal. But sometimes it's not stealing. There's a willing seller, you know, who wants, maybe has 5 other mouths to feed at home, and they need that money. Okay. Yeah.
I mean, when we talk about push factors, and we have also pull factors, they work very closely. You have cartels who are willing to buy children, and we have people who are in need because of either poverty, culture, like she's saying. There is child-headed homes, you know, issues with it to the family, there is factional families, quite a number of things that push these people who are at the vulnerability base of the cartels. And we'll discuss the issues of cartels later on.
But I'd like to bring in Muteru. We've talked about willing seller. Are there willing buyers? I mean, would this be happening if there was no market for these children? To use economic terms.
We'll just go along economic terms. Olive, research estimates that there are about 5,000 to 8,000 people looking for children in this country at any particular time. People who are in married situations in Kenya today, in Nairobi, up to 28% are not able to get their own children. Up country, it's much less. It's about 20%. It's not really much less, but we are talking huge, huge numbers. Those people are looking for children. If I am not able to get a child, where do I start? Now, Pumwani has established a brand name, so I'll start looking around Pumwani.
Unfortunately.
Or I'll go to the nearest children's home. And when I go to the children's home, I might find that I'm being told to adopt, and it's complicated, and I don't have to explain that I got this child and it's not from my tummy. So there's actually an economic aspect. There's a market, and the market is made more available because the systems are not working. All right, so the systems at Pumwani, I mean, it's not the first. 20 years I have worked in child protection and have known Pumwani to be a source of children. And so, source of sellable children, not just a source of children. And so, when the other side makes it difficult, that is the government, makes it difficult for people to access adoption information, you'll be surprised that people actually travel far just to get to a place where it's easy to get a child. Yet there's a children's home nearby you. There is a children's officer nearby you where you can go get help. If the children's officer has no idea, then you'll go and buy. Actually, I know of people up country, far up country, who spent 120,000 to buy a child, clean cash, you know, so 50,000 is no big deal. Yeah, so it's really, the market is there, I can tell you.
Okay. Jennifer, is there a government agency that is charged with ensuring so it's the black market, isn't it?
Yes.
This black market practices where children are concerned, ensuring that children are, I mean, if you're going through an adoption process, it's above board. Is there a government agency that is charged with that kind of work?
So I'll start saying there are 5 government agencies in charge of children. So there's the Department of Children's Services, there's the National Council for Children's Services, there's the Child Welfare Society of Kenya, there's the Street Families Trust, and there's the county governments. So because all of them, the Constitution of Kenya is very clear on what is their mandates. The issue, and there's a committee on anti-child trafficking and human trafficking, which is housed, the Secretariat as the Department of Children's. The challenge is how do we coordinate all this different sector? Because, for example, right today there was a story in one of the dailies about an increase in street children trafficking, and those children are coming from Tanzania. But when you go to for example, the Street Families Trust, they will tell you, that's not our work. Our work is just to give money. You go to child welfare societies. No, that's our work. Our work is to house children. You go to Department of Children's Services. We don't have the money. The money was given to another agency. NCCS, our work is to, it's an overall, it's an umbrella. Our work is policy work. So there is that lack of that coordination. Who does the backstop? You know, who do we report to? Who do all these agencies supposed to say, this is who we are supposed to say? If there's trafficking, who this is supposed to be. So there's lack of that seamless coordination. And that starts from the ground. Who are we reporting to? At the chief's place, for example, this woman is from Nyeri. We should have known someone who is in the village where she should have known that the child that she's carrying is at risk of being sold. And something have been done before the child was even born. You know, what are the systems that we have at the community level to ensure that we protect a child before that child is born? And that comes straight coordination. Okay.
Yes. Evans, how big a problem is child trafficking in Kenya? I mean, it's not really something I hear much about other than maybe in international media.
Thank you for the question, because ANCAN is implementing a program with partnership with Terades Homes, Netherlands, in the porous borders in Busia County because of trafficking of children from Uganda through Busia County to Kenya. And that route goes through, it can go to Kakamega, it can come to Kisumu and then Nairobi. And then we have the Mandera County because of the border issues, and then we have Marsabit County, Moyale areas, and we're working with partners. It's a huge issue. It's only that, you know, child protection is wide, but we have not looked so robustly on issues of trafficking. I can tell you, if you look at the report that was you know, published by the US agency, Kenya is still in tier 2, meaning there is a lot to be done. Cases of trafficking, like I said earlier, this is 1 in a million. We as stakeholders, families, even from villages, we are party to a recruitment process. You get a family from, say, Kakamega. They're willing to give their child to go and work in urban areas in Nairobi. Why? Because of the things we talked about, push and pull factors. Do we have awareness? That will be the issue. Why are people so willing to give out their children? Is it that there are no structures, there is no information regarding the safety of children? The answer I will tell you is yes. We need to have, like she mentioned, communities. We strengthen community child system protection units. Coordination from the government. The example of Pumwani Hospital. Are they aware how that documentation is important to the safety of a child? You know, that card. Are they aware? Who follows through? There are so many gaps in child protection issues that leads, that gives room to cartels to find leeway so that they can find a way. And this is just a mess of coordination. If we get it right, I can tell you we'll be far.
We'll be very far. Yeah. Okay, I want you to come in, Muteru. How much does culture play a role in this sense of one side of the coin, you know, is acting like children are disposable, and then is there like a shame associated with the other side? Maybe people, you know, just don't want to come out and say, I'm struggling, we are struggling in getting a child. How big is culture a factor?
Okay, I work for an adoption agency, and that question, I interact with it every day in 2 ways. That people, the people who come to look for children through adoption have to come and explain how they are not able to get their own child. These are the reasons. And that is all around sexuality, fertility, and you know, I think every day I meet a family that has had gone through an operation, maybe fibroids, maybe low sperm count, those kind of things. And those are things that are difficult to say. On the other side is taboo babies. There are constantly people coming to our office, which is the legal way to give up a child. If that lady had gone to an adoption agency, she would have legally given up a child into the system. Which, what we do is put the child into the system so that there is no linkage between a buyer and a seller of children, so that her intention, which was to get some money, is answered through another system, and the person who needs a child comes in and gets a child without having to part with loads of money and without having to be left with this hook and sense of guilt, where 5 years down the line this mother may show up and say, you know what, life is better now. Which we have seen a lot. I have met parents who bought a child from a high school girl 11 years ago, and then the
she
girl
turns up on their doorstep.
Yes. And what do you do? I mean, what do you do? You've lived with this child for 11 years. You've not told them that they are not born here, and then this and they parted with money, and she was not willing to give back the money, and the person who had facilitated it says, just give back the child. What do you do?
Because where do you run to?
Yeah. So we interact. There are cultural issues. There are babies who we classify as taboo babies, babies born of incest, babies born of rape, babies born like twins, or who have a slight disability and things like that. Some children in some of our cultures really are cursed. And there's nothing you can do about it, because if, as the lady explained over there, that child will get killed before their first birthday for some reason, out of wedlock, something. The relatives systematically end the life of this child. So the best place to do is give up the child, get the child into a place of safety. So culture does affect a lot.
Clear rule. I'm still stuck on the fact on who protects the interests of these children. You talked about a system.
Yes.
This is with regard to adoption.
Yes.
Who manages that system?
There is a National Adoption Committee, which is currently alive and active, which gives licenses to adoption agencies. Adoption agencies work, as I told you, my daily interaction is to get children from people who want to give up legally their children to adoption, or just want to give up their child, and let the system, which is the government and the license agencies, to take care of that child. And then there's the Department of Children's Services. Their role in adoption really is to facilitate and inform. Inform two people, inform the general public that there is a place of safety and there is a place you can get children if you want. And then also inform the courts, because the last part of the adoption process is to, through the court, register this child into the new family. So the court requires them to come and say that this child was properly moved into this family through an adoption agency. A legal means was used, and then of course give assurances that to the court that this is the right thing to do for this child. So yeah, there is a system and it exists. It's a network of Children's Department, the judiciary, and it is all supervised by the National Adoption Committee.
Okay.
Yeah.
All right. Evans, I'd like to speak more to these push and these pull factors, especially as in your experience, we've talked about culture, but how big a role does economics, like now strictly speaking, not as an analogy, but strictly speaking money, in terms of need, sort of create this market for child trafficking?
Well, I think when we talk about the push and pull factors that leads to children being trafficked, this is an issue that is alive.
Actually, why don't we start from the point at what is child trafficking?
Child trafficking, it's a process where you have a child moved from one point to the other point.
Are we talking across international borders?
It's internal,
or it can even be internally?
Internally, even within Kenya, within towns, across borders. That's why I mentioned that we are doing a program that focuses both internal and cross-border. So that movement of children, even without, children don't have a consent, unlike the adults. When you talk about human trafficking and child trafficking, there's a slight difference. So when you talk about the push factors, here you find that a family that is doing badly in terms of the economic setbacks and within the family, and you find that you have 4, 5, 6 children within the family, and that's actually lack of information on reproductive health, and that has an impact also on the economy, on how far you can go in terms of providing for your children.
It is. I mean, it is expensive, I
yes.
think, to seek out. I'm sure you have experience
yes.
with your clients.
Yes.
Getting this scientific health interventions, it's expensive. It must be
nowadays information on how you can,
endeavor.
Yes, it's a lady.
It's about 400,000 on the minimum to do an IVF.
Yeah. So
an IVF is less than 20% chance of success. So most people end up doing 3 or 4 IVFs.
Yeah.
So put that together, you're talking slightly less than 2 million.
Well, no, I did not know that. That 20%, less than, you said less than 20%.
It's 20
chance
to 40%, yes.
20 to 40.
Per trial.
So when you have, that issue within the family, where you don't have a breadwinner, I talked about child-headed homes, where you have maybe for fate may hurt it, so the parents or the guardians died. So the children remain vulnerable. So that's where you find the push from the family to these children. Nobody within the family safety net is willing to take this, and it's sad. So children remain vulnerable, and they become prey to these traffickers, which are readily available, like I mentioned, and they're quite numbers. And then we have the question of push, where you find that maybe a girl within the family has given birth, and we talked about the issue of unwanted babies, taboo babies. So for you to have that clean, to be in good books within the family, you have to give away your child, which is something that pulls you because of either culture, economy, and other. Those are some of the things that puts these children to be in a vulnerable ground. And of course, when you talk about issue of readily available market, that also play into part. So there's like this together. So when you have a society where you don't have information on this, that also contributes a lot to the vulnerability of these children. When you don't have awareness to either to the system, to the family, they don't know child safeguarding guidelines, how they can ensure that if at times these things are innocently done, you find that you've given birth in an hospital and your child is gone because you don't have information on how you can track your child. You can be told that the child is dead while she's alive, or he's alive and is been swindled. Yes.
And I remember Jennifer was asking about birth notification,
documentation,
where the story we aired on the mother willing to sell her child was concerned. But Jennifer, you spoke of this lady. She had 4 children. She came to you. She said she had 4 children who are sitting exams, right, in school, 2 of them. And then, so here's another baby that she has. So what options are there? Like in the movies, you hear a child, they'll leave a child on the doorstep of a fire station, but that's in the movies. Where do I go if I have a child that I cannot, in good conscience, raise, other than sell them, other than flush them down the toilet, other than, leave them abandoned? You've heard those stories where, in a trash heap, a baby was found. What are my options?
So I was add on what Evans has started. I was just saying, in Kenya, the average income is $2.5 a day. Yeah. And imagine you're getting $3,000 to sell a baby. So the option is give back, get the $3,000, maybe reinvest in something else. Yeah. So there are options to where you can be able to drop children. For example, Muteru said, you can drop them at Department of Children's Services. They will take care of the child. Say, I'm unable to take care of this child. Please help me. There are numerous of children's baby facilities. For example, I know, for example, New Life Homes, they can pick up your child. If you're unable to do that, go to any church and drop your child there. Instead of selling that child and say, I am unable to take this child, can you put this child in a safety? There's many safe homes all over the country. Actually in every major town, you find a safe home. But the first stop is Department of Children's Services. If you don't have a Department of Children's Services at whatever level, go to the chief's office. Go tell the chief, I am unable to take care of this baby. Can you? Yeah, or the village elder if you don't have a chief. And I'm sure, and I think Evan said something about community policing, nyumba kumi. Are you able to talk to your nyumba kumi and say, yes, I am going to expect this child, but I don't want to abort this child. I don't want to abandon this child in some street, but are you able to help me to take this child somewhere else? That's saying community safeguarding systems, you know, the Ubuntu, you know, it takes a village to you know, how are we able to strengthen that system, the Ubuntu system of it takes a village to ensure that our children are safe from the community level.
Okay.
Yes.
She talks about Ubuntu and it takes a village, and you know, but is this a bigger problem in the cities, Muteru, or than it is, for example, in the village?
Of course. If I'm pregnant, and everyone around me in the village sees I'm pregnant, and then a week later after delivery, I don't have my baby, there'll be big questions. The chief will ask, my neighbors will ask, and you can't say the baby died. You didn't bury, we didn't see. So what most people do, let me say from up country, is take, you know, 1, 2, 3 buses. You travel, let's say, from Meru, you go to Nairobi, and then you go across the land, maybe to Kisii, leave the child there. Why? Because if you try to leave the child, if you're coming, let's say, from Meru, and you try to leave the child in anywhere within Meru town, there's a system. The police will look for who abandoned this child, and, you know, the people will say, and people will start looking for that child. So people, most mothers change buses, go to a faraway land. And then, of course, the other way of doing it is to just simply abandon. You need to know that, you know, as we mentioned these cultural aspects, there are some people who are really scared of their children dying. I have heard from mothers who give birth to twins and it's taboo. And you know, there was this ceremony to hold the baby, and one of the twins was killed, so she was very sure the next one is going. Killed in faked accidents, you know, so in such a case, you run, you wake up and run. In fact, that lady...
Those cultural beliefs still exist in 2018.
Yes, they do. So you wake up and run. You actually, this lady says she's going to the shop. And they said, no, let's hold the baby for you. She said, no, I'm going to the shop. She took a bus from wherever and came to Nairobi. She had no idea, you know, everything. So she had to be given bus fare when she arrived. And, you know, we were very sure she's going to come back for the baby. She didn't. And you know, she gave up the child legally. So yeah, there is community mechanisms, both good and bad, which really help and protect children. But people take drastic actions in abandoning their babies. So yeah. Okay.
But then I'll stay with you. There's this concern that some centers actually take advantage of these children and then perpetuate a cycle of abuse. Do you think enough is being done by the investigative authorities and the prosecuting authorities, sort of like to license all these? Because I mean, there's a time I think there was a home on every corner, you know, every street corner. Who licenses these organizations? Who ensures that they are up to standard?
It's supposed to be the National Council for Children's Services. What they have is area advisory councils. Now let's just make it simple, using the Children's Department. And there's supposed to be an inspection of the homes from an area advisory council. But right now, a lot of research is showing that children's homes are not good for children at all. And if we can find that child a family, our current government system is actually supporting families to keep children. So there is something called the National Safety Net Program for children.
Alternative care programs.
And alternative care programs. They're pushing children's homes to close because it has worked in other countries and it's showing. The UN actually, agencies say that it's not good for children to be in homes. They develop less, they are less accountable. If we were siblings over here and you did something wrong, you would learn to be accountable for it. But if you are 20, 30, 50 children, some homes have as big as 1,000 children, 100, the average is about 100 to 200, but 1,000 children. So that means you learn to lie your way through life. Also things like the self-esteem of children, you know, fighting and those small things, you're unable to go through life alone. But if you're in a family, you have a very close network support system. So the government is trying to encourage people, don't say poverty, but actually go to the government systems and you will be assisted. Actually right now there's a fund that gives families 5,000 I think per child. So there is a safety net program, but you have to keep the child in school, you have to register for NHIF, all those things, which are awesome because the child gets healthcare, the child gets schooling. And so there are systems. Children's homes are not being registered anymore as far as I know. The minister said, I think 3 weeks ago, that there is little chance that more are being registered. There is a need for children's homes. As you can see, there is a need for a place where a child is rescued and taken. But the children's home commits to find a family for that child. If there is no information for that child, then find a new family, an adoption family, a foster care family. If there is information, then support the family that gave up this child, that abandoned this child. Support them so that they don't say it's poverty. And that system, I must say, one of the things I admire currently is that that system is working.
Ah, okay, fantastic.
Yeah.
Evans, you were really agreeing with what
Yeah,
he was saying.
it's important to have these children grow within the society, within families, because there is a benefit later. And research has shown that majority of the children homes, what we call the CCIs, they are not measuring up to the minimum standards that are required by law. 1. 2, even in those children homes, majority of them, they abuse the children. So, and I think the government put a moratorium to not continue registering those children homes and embrace what we call the alternative care program, where we need to move now these children within families so that they can grow with other children and the things he talked about, they get the services, they interact with other children so that they feel part of the society. And like, you know, putting them in a closed corner.
Okay.
Yeah.
So I remember when you started speaking, one of the things you spoke about, Evans, was a lack of awareness. And Muteru brings in the aspect of this child's welfare system. Do you think enough has been done to make people, rather to sort of push people towards taking advantage of these systems in place?
Well, I think...
sorry, Jennifer. Jennifer.
The question is, do people know about these systems?
Yes.
I don't think people know enough about these systems, especially maybe in Nairobi, and now specifically in Nairobi, that people would know probably there's a Department of Children's Services at that corner, or there's a Child Welfare Society offices on this other corner, but or there's an NGO, because those are huge. NGOs are playing a huge role in child safety in Kenya, but in rural areas, people really don't know. And like today I was reading a story in the dailies about this child who was adopted 11 years ago, and then the parents split up, and then the mother was unable to take up the child, and the dad married another wife, and that child was left like that. So and they were saying, so the question was online was, who is responsible to this child? Who is responsible for this child? And people don't know, actually, that child, you can take that child to the Department of Children's Services, and Children's Services can be able to know what to do with that child. there's so many safety homes, and like that lady.
Well, where can I find this Department of Children's Services? Do I have to travel all the way to Nairobi?
Yeah.
Is it a devolved unit
Yes.
of government?
No.
Do I go to a Huduma Center? I mean, like, where do I find it?
So, Department Children's Services is not devolved, but there's in every sub-county, there is a Department of Children's Services, and most of the time they are housed under the former DC's office.
Yeah.
What are they called now?
The administrative.
The administrative, where there's a chief and everywhere. So, and every chief, at every chief camp, there is what they call volunteer children officer. So if you go to the chief, you say, I want to see the children officer, they're going to refer you to the volunteer children officer. And currently, I think they're quite a number, about 750 all over the country, and they're from the grassroots level. That's where you can be able. But still, what we are advocating for as the civil society in Kenya working for children is how can we be able to strengthen what the AAC, the Area Advisory Council, which is quote-unquote devolved function of the National Council for Children's Services, where they can be able to play and to do the administrative roles, to oversee, to ensure that the children's homes are run well, that the number of ABIs collecting data on children issues at the community level. That's what we still are struggling with, but the Department of Children's Services, they have offices all the way to the sub-county, and then children officers, the volunteer children officers are there, every chief camp.
Okay.
Yes.
All right. Just
I
before
must-
I come to you, Muteru,
Mm-hmm.
this aspect of syndicates, you know, when we're talking, for example, about child trafficking, and we're talking about syndicates, you keep hearing every time there's a news report on a child having been abducted, the word syndicate comes up. Where do they take these children? I mean, is it just maybe to sell the children to prospective parents? Is it, I don't know whether you've seen the movie Slumdog Millionaire. It was a few years back, and they had these children who they would get to beg or on the streets. So where do they take these children?
When I was explaining what is trafficking, I think it's important to mention the purpose. When you move a child from point A to point B, what is the purpose? There are so many purposes why children are trafficked. One, of course, for exploitation purposes, that these children are going to be used as beggars. There are so many Tanzanian children in the streets that are used to enrich some people. Some children are going to be used as child laborers in some countries, in some towns. Some of these use their parts. These children are going to either to be killed, especially in cases we had from Saudi Arabia and the Middle East, whereby people use some parts of the body and they use children. And these are real cases, I can tell you. So there is always a purpose why children are moved from one point to the other, and the purpose is clear to the cartels, especially when you get these children who are born with different, features in their body, so they are unwanted in the families. Many times they find themselves being used to be sold for purposes of either, their body parts to be sold for purpose and gain for those syndicate cartels. Yes.
Okay. Muteru, you wanted to come in, and also I'd like you, as you give your comment, to move the conversation forward in terms of what we need to do now.
Okay.
Okay.
Yes.
I'll just relate to trafficking. A lot of times trafficking and adoption, people don't know, it's hazy. So one of the purposes for which people traffic children is to feel an actual need in families for children. So that is also trafficking, and it occurs locally and internationally. Trafficking for adoption, as it is called, there's two kinds of trafficking for adoption. There's trafficking for adoption and trafficking through adoption. Both of them are difficult to happen in Kenya because the amounts of money involved are huge. There are millions. And in Kenya, it's relatively cheap to get a child properly through the adoption system. And then there are so many stages in the adoption of a child in Kenya that it doesn't make sense to try and traffic through adoption in Kenya or traffic for adoption in Kenya.
That's the first time I'm hearing that term or turn of phrase, traffic through adoption.
Yes.
Wow.
Trafficking through adoption is really where you say that I am adopting this child, and then I go probably to another place, another province or another country, and give up the child, sell the child. Let me say that, sell the child. If you have to do it through the adoption system in Kenya, you'll have registered so many documents that it's not going to look good by the other time to go and undo that on the other side. So what people do is say, I have given you my child, which is something called guardianship. And then you travel. But the problem with that is that if you travel with a child on a guardianship in Kenya, you're only given the visa period. That means you have to answer the question of what happened to the child on the other side. So internationally, children are trafficked in Kenya or through Kenya as a transit. So Kenyan children are not really affected. It's children coming from, let's say, Ethiopia, going all the way to South Africa, that kind of thing. So it's a transit point. The Kenyan system does not allow for Kenyan children to be trafficked easily. What's the state and what are people doing? Actually, right now, our biggest need is, as we were saying before, information. Unfortunately, even children's officers do not know about adoption, about these options available. So if I go looking for a child and I have to keep a secret and all that, and then the children's officer, soon, the chief knows, soon, I don't know what, they actually do not know. So there's a lot of technical information required, and then of course public information. You didn't know about the National Child Safety Net program, which is a very elaborate program. So the first point of intervention in Kenya is give proper information to everybody, to the right people technically, that's the officers, and then to us, where do we go? Where do I go if I need a baby? Where do I go if I need to get rid of my baby? Secondly is coordination. A lot of government resources, a lot of national funds, I can tell you to the billions, have been lost in Kenya because the coordination mechanism in the children's sector is terrible. We kind of have one plate, and it's like giving food on the table, and you have 5 children. There are 5 different agencies.
And that's the point you raised in terms of,
So and then you don't say whose food it is.
Yes.
You'd rather take turns or just divide the food. So, they pour out the food. And so there's a lot of conflict because of that between government child serving agencies. Some of them are not well registered. Some of them are not well monitored. And so the other one, who feels responsible comes in and doesn't have the money. and so that conflict is ending up with situations of exposure to children. And lots of children are passing through the system, being bought. And I must tell you, I said there are about 8,000 children, 8,000 families per year looking for children genuinely. Yet there is a system that can support them to genuinely get children. Okay. And then we won't have cases like the one Jennifer is describing. 10 years later, we don't know whose child this is. An adopted child is a child of that family. So it should be a custody battle, like the child was born there.
So, one of the proposals of government, Jennifer, is to sort of, when children are enrolled in school, they get this unique identifier number that they carry with them throughout their school life. Do you think that would be of assistance in terms of tracking these children?
It will be. Before I tackle that, I want to add on what Muteru is saying. What needs to be done? Passing of the Children's Act. Right now, we have a children's bill that is, I think, right now it's at the cabinet or somewhere.
And does that fall to the ministry that's charged with youth affairs?
Yeah. Yes. No, children.
Children.
We are labor, not children. So that it has taken us 16 years to review the Children's Act. And if we review the Children's Act, some of these issues will not have to deal with them. I've been challenging our members of parliament. Why not pass it before December? If this case and the one that is on the dailies today is just a tip of the iceberg. Maybe one in a million cases. And tracking, yes, it will help in the tracking, the unique identifier. But will it deal with issues to do with adoption or issues to do with trafficking? Because those are issues that need to be anchored on a policy, on a law that helps regulate how, like, if this child is, for example, let me call that child Mwangi, I can't remember his name, who was bought, according to the dailies, that child was bought. And now that child doesn't have a home, and can it track? But now, where does that child go? We have a system, a government system that ensures there's that transition from one home to the other, that ensures that this safeguarding of this child is of the paramount importance above everything else. That child, today, the picture on the daily is that the child is beaten up, all bloody and stuff. How we ensure that child is not harmed, that we need a very strong law in addition to the unique identifier. Yeah.
Okay.
Yeah.
Evans?
To add on what needs to be done, I think it's important to mention that of course, the Department of Children's Services is doing a lot. The civil society organizations are doing a lot. We need to ensure also that the child is empowered when we talk about information. Because when we talk about self-protection, it's also important to
That's
ensure
an interesting aspect.
Yes, to ensure that the child is given information. Through this program that we are doing, we have created, through schools and through Teacher Service Commission and Ministry of Education, we have gone through some schools. Children are trained, more importantly, what is trafficking, what is child protection, what they need to do, and forming child rights clubs. In the community, we have what we call community surveillance teams, which are like community resource persons, which gets information, create empowerment, doing capacity building, and all that. And we are targeting even the media. Listen to the media so that you can focus on this issue. Awareness creation through media, both electronic and print media, so that information reaches to every corner. I can tell you some things are done kienyeji because of lack of information, you know. And our government agencies, the DPP, and they are doing a fantastic job. The police, the judiciary, and we are engaging them soon so that we have this discussion on what are some of the legal frameworks they can apply, because also that's a challenge. I can tell you, like in child trafficking cases, many of them, they don't see the light of day because of the legal challenges and clear laws that point into issues of trafficking.
What are the legal challenges?
It depends on what is the case presented and how it's presented. We have, like, for example, the Counter-Trafficking in Person Act, you know, which in some cases, it is information or rather how to prosecute and how to convict a perpetrator on trafficking. But it needs to be more clear when we are dealing with children. You understand me? And how to handle cases of children is of importance. You can't handle a case of children like any other case. I mean, this is a case where you need some safeguarding principles to apply, and the sensitivity of it.
In terms of having their identities protected? Or?
That's one. And what needs to be done so that, a child doesn't have a voice. Somebody has to speak for them. And we have so many. I talked about cartels. When you allow these things to come into play, the child cannot get justice, or the families of that child cannot get justice. It's important to address that. And also, when we talk about laws, we have so many laws in this country that are not in preach. I mean, Kenya is a hub of policies and documents that are used for benchmarking across the region. You know, it's important now that all the departments, right from the government agencies that I've mentioned and civil society actors like us, that we need to go down to the ground so that we have data, we have information, so that we can come up with programs and interventions that work, not theories. Not top-down approach, it's bottom-up approach that creates sustainability. We engage the community, we engage everybody, so that when we talk about area advisory councils, you know, when I wish we had time to discuss about that. because when you look at the mandate of area advisory councils, it's huge, including
Wait,
children.
who constitutes this area advisory council?
It's a multi-sectoral from government to civil society.
And when you say area, how big an area are we talking?
Area,
a sub-county, actually a sub-county.
What was formerly a district, so it's
yes.
a sub-county.
It's a sub-county.
Let me add to what he's
saying.
saying.
And who constitutes it as you add to what he is saying?
Different people.
The
no, the local guys. The social worker, the health worker, the person who's in charge of the hospital, someone who runs a children's home, or all the children's homes. It's all coordinated by the children's officer. Jennifer mentioned that there is a children's bill. What the children's bill has done is take all these responsibilities and name who's in charge of data, who's in charge of health, what happens to a police officer when they have a child, somebody reports the child. What happens to a child who is sexually abused? Whose responsibility is that?
Is this addressed in the child's?
Yes, in the draft children's bill. It just needs to pass into law. So we've worked on it. It's modern. Is it a crime to, for example, in Kenya, is it a crime to follow up a child online, online pests? All that is in the draft Children's Act. And we, you know, the government system and the Attorney General are dancing around it. Yet it can go to Parliament and be passed by the end of the year, as she said. It's a complete document, very well technically drawn up to handle all current issues, including this coordination problem that we've been saying, we don't know whose food this is. So yeah, that's the solution, one of them,
right.
like from
So
government.
let me finish with you, Evans, because I know I cut you off.
Sorry.
Yeah, the bit came sweeter. Now, I talked about coordination, and I think it's been explained. We need to come up with concrete programs that work, not theoretical programs, not policies that are, you know, not working. And I mentioned that there are so many. When you talk about child protection in this country, there are so many documents. Do you know that, like, the National Plan of Action that just expired, that we are going now into review, when you look at what are the achievements, we have good documents, I can tell you. We have even county child protection guidelines that some of these practitioners, I can tell you, may not even using it.
Okay.
So what needs to be done is that even the families come up with, as now the civil society organizations and government, come up with community programs targeting the child and the families across to the government, so that everybody is involved, everybody is informed, so that later on now we start asking, this was your role as police, what did you do? This is the role as a judicial officer, what did you do? This is the role of a children officer, how did you perform your functions? So that we ask ourselves honest questions, and then we lose these gaps that are happening. I can tell you for now, we have so many gaps that allow this syndicate, that allow these crimes to thrive. Yes.
I thank you very much. And I want to take that conversation online. Unfortunately, we don't have much more time. But what's your Twitter handle?
My Twitter handle as a personal is at Ivan Munga.
At Ivan or Evans?
Ivan.
Ivan Munga.
Ivan Munga, and then at regional, Ancan Regional.
Okay.
At Twitter handle.
Mine is at Dalitso, Dalitso, Dalitso.
Okay. How about you?
At Change Adopt. At Change Adopt.
Okay.
Yes.
All right. So thank you very much for your time and your contribution to this discussion. I think we need to move it forward. I know a lot of people would like to understand how the adoption process, for example, works in terms of a step-by-step guide to that. So we do intend to continue this conversation.